Headaches due to decreased intracranial pressure. A cerebrospinal hypotension may follow the diagnostic lumbar puncture, myelography, or spinal anesthesia. Low intracranial pressure can cause headache elicited by sitting or upright posture and relieved when the patient lies flat. Perhaps the common cause of the headache is that occurs in 13% to 40% of patients who undergo lumbar puncture. Since it develops usually during the hours following the procedure, the headache typically recurs when the patient assumes the upright posture and markedly diminishes within minutes after lying flat. Nausea, vomiting, and rarely a sixth cranial nerve paresis may occur, remaining recumbent for hours after the procedure does not reduce the incidence of the headache. The larger the caliber of the needle to puncture the dura, the higher the probability of a spinal headache. Only 2.5% of patients whose spinal tap was done using a needle with a conical tip and the side aperture developed post-lumbar headache. Most often headaches caused by the spinal taps last several days or weeks. Treatment includes the hydration and the bed rest. In refractory cases, epidural injection is at the level of the bevel of the spinal tap of a patient's own non-anticoagulated blood relieves the spinal headache in most cases. Any cause of leakage of CSF resulting from head or trauma, erosion of the meninges by an invasive tumor or dural tear or avulsion of a spinal root can cause intracranial hypertension. Intracranial hypertension, this can be idiopathic. As with post-lumbar puncture headache, others caused by reduced intracranial headache are postural CSF pressure to be below 60 mm water, MRI may document the downward sagging of the cerebellum and brainstem. With gadolinium injection, there may be enhancement of meninges. Migraine. The profession of migraine is difficult to determine because the diagnostic criteria of the International Headache Society do not distinguish it from the cervical headache. Migraines tend to begin in the adolescence, sometimes preceded by related symptoms such as bouts of vomiting and or abdominal pain, increased susceptibility to motion sickness and vertigo during childhood. In adults, women are affected 3 times as often as men, while in children and male to female ratio approximately 1:1. Pregnancy may be associated with a relatively remission of the common migraine, whereas the use of the birth control pills may be exacerbated by middle age. The migraines may cease to occur to alter their quality. A more chance association between migraine and the hypertension. Migraine and hypertension, myocardial infarction and stroke has been described. Usually migraine is familiar. Thank you. I'll come with my video lecture series with my next session.